Hi, this is Kamini with Chai.com. This year I'm launching a series called Chai and Chat with people who I think may be helpful in helping us find ways where we can live happier, healthier lives. My first conversation is with Dr. Richa Mittal, who is a specialist in weight management and lifestyle management. Our conversation happened this February, which is also Heart Healthy Month. And so we talked about 3 different things that we as women can do right now to help improve our heart. Number 1, know your numbers. Number 2, make changes in your lifestyle. And number 3, find ways to decrease stress. We go deeper into these topics, and we hope that you'll enjoy this conversation and learn as much as I did from Richa. Hi, this is Kamini with Chai.com. Today, I am so excited to have a conversation with Dr. Richa Mittal, who is a physician of obesity and lifestyle management in Frisco, Texas. Thank you so much for joining us for this conversation. We're going to talk about women's heart health. So what would you say are the 3 most important things that women need to think about when they're thinking about their heart health?
Is number 1, know your risks, know your numbers. So if you haven't been in to see your doctor lately, get your labs done so you know what your blood sugar is doing, how your cholesterol is looking, and have a blood pressure check. So when you know your numbers, you know your risk factors for developing heart disease. Number 2, I would say work on your lifestyle. You don't have to be perfect, but making small tweaks and changes in areas like your nutrition. Could you eat an extra serving of vegetables and fruit? Could you maybe reduce the amount of ultra-processed food you're eating? When it comes to movement, could you be moving a little bit more, being less sedentary, working on strength training? Sleep, that's a common one that sometimes we ignore. And of course, in later stages of life, women during perimenopause and menopause can start to have problems with sleep and sleep disruption. And last but not least, as you mentioned, stress. And of course, we can't get rid of stressors, but we can change the way that we deal with them. And understanding that we can take little, what I call pressure valve releases throughout the day, so that we don't get to a point where we're just worked up and so anxious and so stressed, because stress does increase our heart rate, our blood pressure, and it negatively impacts our heart and our brain. So we want to think about ways to relax, whether that's meeting up with a friend, sitting down and enjoying a cup of tea, going for a walk. These are all small ways that we can work on reducing our stress levels.